Fox 5 health news now, and two new studies on Avastin say that it can help battle early-stage breast cancer. The drug recently lost FDA approval for treating advanced stages of that disease, but it is still being used to treat other cancers in the lung, kidney, and also colon.
All right, joining us right now is Dr. Mark Melrose from Urgent Care in Manhattan. Thank you very much for being here, Doctor. Let's talk about the two studies done. How effective was Avastin in treating breast cancer?
Well, in looking at treatment of early breast cancer, there was a United States study and a German study done that looked at the use of Avastin plus chemotherapy and chemotherapy alone to treat early breast cancer prior to surgery. In the U.S. study, 34% of patients who were treated with Avastin and chemotherapy versus 28% of patients who were treated with chemotherapy alone had no visible evidence of a tumor at the time of surgery to look for any microscopic evidence of breast cancer. And in the German study, which was a little bit more comprehensive in the criteria, looked at 18% with Avastin plus chemotherapy versus 15% with chemotherapy alone.
Well, you know, got to ask you, doctor, since there are some promising results that we're talking about now for early stages, do you think it's worth it for them to go back and look and see whether or not Avastin could be helpful in all stages of breast cancer now?
Well, the measure of success for the treatment of any cancer is long-term survivability. And so we always look at the potential for side effects or undesirable outcomes based on therapy versus no therapy. And so we really need to look at the long-term results of this study on Avastin to determine if it will ultimately be successful in the treatment of early stages or any stages of breast cancer.
All right, on another subject, let's talk about our hearts, okay? A healthy heart is important, and we understand if you're kind of healthy during middle age, it helps you as far as the risk for future problems with stroke and everything else.
This was a very interesting study published in the New England Journal this week that looked at over 250,000 patients who were actually parts of other studies that looked at other medical outcomes and looked at other indicators of health. And so when they combined these 18 studies and looked at these 250,000 plus patients, we found, or the reviewers found that if you maintain a healthy lifestyle up until 45, up until middle age, that limits or eliminates the 4 known modifiable risk factors for heart and cardiovascular disease, which are diabetes, smoking, high cholesterol, and hypertension, you have practically no risk later in life of developing cardiovascular disease. For men, the risk was almost 1.4%, and for women, the risk was just over 3% of developing any cardiovascular disease later in life. And this is super important because cardiovascular disease is the #1 killer of adults in the United States.
Take care of yourself early on.
Absolutely.
Yeah.
Cheers to black tea.
Cheers.
Tell us about this. Could be good for lowering blood pressure, huh?
So
we always hear green tea is the perfect, concoction.
Well, in Australia, there was a study that looked at about 100 people who were randomized to either drink tea or not drink black tea, and other factors such as caffeine were controlled for. And it was found that the tea drinkers who drank approximately 3 cups of black tea per day had a 2-millimeter decrease in both their systolic and diastolic blood pressure. That's the top number and the bottom number. And this is very interesting because of the huge number of people that have hypertension, high blood pressure in the world and in the United States, because if we can lower their blood pressure just by a little bit by changing their everyday eating and drinking habits, this is significant. Even more significant is if they can identify the actual component of the black tea, it may prove to be a natural source of treating blood pressure in the future.
Exactly.
It's okay.
Good health to all of us.
And the green tea.
Sure thing.
Dr. Melrose, thank you so much.
you.
We certainly appreciate it.